A patient in upstate New York tested suspected positive for hantavirus yesterday. The hantavirus everyone has been talking about is on a cruise ship in the Atlantic, and the two are not the same disease. The county's public health director, Kate Ott, called the timing horrible. The announcement came on Friday, the 15th of May, 2026. For 2 weeks before that, the only hantavirus story in American news had been the MV Hondius, with 10 cases, 3 deaths, and 41 Americans across 16 states being monitored by the Centers for Disease Control. But the patient in Ontario County never went near that ship. By the end of this video, you'll know what the New York case actually means, why the cruise virus and the American hantavirus are almost different diseases, and what the rest of the country should and should not be worried about. The town is Hopewell. The county is Ontario in upstate New York, halfway between Rochester and Syracuse. On Thursday morning, the New York State Department of Health called Kate Ott, the county's public health director, with a question they did not expect to be asking. There was a patient in her county who had been mildly unwell for several weeks, with fatigue, body aches, the kind of long, low-grade illness most people would chalk up to a flu they could not shake. The patient's blood work had come back with one particular flag on it: hantavirus. Otit went on local television the same day. The quote she gave is the most revealing sentence in the entire 2-week coverage cycle. "We thought surely this can't be hantavirus in relation to what's going on in the media at this time." Then she said it again, in 2 words: horrible timing. The blood sample is on its way to the Centers for Disease Control and Prevention in Atlanta for confirmation. Until those results come back, the New York case is suspected, not confirmed. The patient is recovering. Ott took pains to point out that there has only been one other suspected case in Ontario County in the last 20 years, and that the patient never went on any cruise. That last detail is the one the rest of this video is about. Because for the last 2 weeks, the only hantavirus story in American news has been the MV Hondius, a Dutch-flagged expedition cruise ship that left Ushuaia in Argentina on the 1st of April. 2 stops in the South Atlantic at Tristan da Cunha and St. Helena. By early May, passengers were falling ill. By the 11th of May, the ship was docked at Tenerife under quarantine. By the morning of the 12th, the first batch of American passengers had been flown to the National Quarantine Unit at the University of Nebraska Medical Center in Omaha. Today, the World Health Organization is reporting 10 cases, 3 deaths, and roughly 41 Americans across 16 states being monitored for possible exposure. That outbreak involves a strain of hantavirus called Andes virus. The patient in Ontario County does not have Andes virus and could not have, because the rodent that carries Andes virus has never lived in North America. 2 different stories wearing the same word. This matters more than it sounds. There's a reason Kate Ott, who has presumably had a long week, used the phrase horrible timing on local television. The American public has been primed for 2 weeks to treat the word hantavirus the way it once treated the word coronavirus. The cruise ship triggers a kind of muscle memory. The respiratory illness language and the 42-day quarantine reinforce it. And then a patient in upstate New York tests positive for something that shares only the name, and the whole conversation collapses into a single panic. To understand what is actually happening in New York this week, and what it does and does not mean for the rest of the country, the story has to start somewhere. Most of the coverage has not been. In the United States, in 1993, with a young couple in New Mexico, both healthy, both dead within a fortnight, of an illness nobody at the Centers for Disease Control could yet name. In May of 1993, a young man in New Mexico, on his way to his fiancée's funeral, collapsed at a gas station with sudden severe shortness of breath. He was rushed to hospital. He was dead within hours. His fiancée had died days earlier of the same thing. They were both Navajo, both healthy, both in their late teens, and nobody could explain what had killed them. What followed was one of the fastest outbreak investigations in modern American public health history. Within a month, a team from the Centers for Disease Control, the Indian Health Service, and the New Mexico State Lab had identified a previously unknown virus. The virus belonged to a family that had been known to medicine since the Korean War, hantaviruses, which had only ever been documented in Asia and Europe, and which had only ever been seen to cause kidney disease. This American version did something different. It targeted the lungs. The clinicians watching their patients die described the lungs at autopsy as resembling water-laden sponges. The virus was first proposed to be called Muerto Canyon virus, after the location of the outbreak. The Navajo community objected. Naming a disease after the place where their relatives had died was not something they were willing to accept. The virus was renamed. The Spanish phrase for nameless became its name, sin nombre virus. That was 33 years ago. Since the Centers for Disease Control began counting in 1993, 890 Americans have been confirmed to have caught hantavirus disease. Roughly a third of them have died. The geography is striking. The vast majority of cases are clustered in the western and southwestern United States, in places where the deer mouse, Paramyscus maniculatus, lives in close proximity to human habitation. 62% of all American cases have been in men, mostly working-age men, because the activities that put a human in close contact with a rodent infestation, cleaning out a barn, sweeping a cabin floor in springtime, mowing a field with old hay bales in it, are still mostly done by men. The disease has had its set-piece moments. In 2012, 3 visitors to Yosemite National Park died after staying in tent cabins that had become infested with deer mice. The park closed those cabins and started a national conversation about the recreational exposure route. In 2020, the Centers for Disease Control investigated an outbreak in pet rat breeders in Illinois and Wisconsin. The first sign that old world hantaviruses, the kidney disease kind, were quietly circulating in American domestic rats. And in 2025, a high-profile celebrity death from hantavirus pulmonary syndrome in New Mexico became the most covered hantavirus event of the decade. It is when most Americans heard the word for the first time. What almost none of that coverage explained is that there is more than one kind of American hantavirus. Sin nombre is the famous one. But there is also Bayou virus in the rice rats of the Gulf states, Black Creek Canal virus in Florida's cotton rats, and most relevant to a patient in upstate New York, the New York virus, identified in white-footed mice across the Northeast. It is rare. It exists. And a clinician in Ontario County who saw a patient with a flu they could not shake is exactly the kind of doctor who would, in the back of their mind, consider it. Here is the biology, end to end. Hantavirus is not a single virus. It is a family, the Hantaviridae, with dozens of members spread across the rodent populations of every continent except Antarctica. Each kind of hantavirus is paired with a single species of rodent host. Sin nombre with the deer mouse, New York virus with the white-footed mouse, Andes virus with the long-tailed pygmy rice rat, which lives only in the southern cone of South America. The pairing is ancient. Rodents and their hantaviruses appear to have co-evolved over millions of years, which is why, in their natural host, these viruses do almost nothing. A deer mouse infected with Sin nombre virus does not get sick. It does not look ill. It continues to do what mice do, which is to live in walls, attics, sheds, woodpiles, cabins, abandoned cars, and barn corners. And throughout its life, it sheds the virus continuously in its urine, its saliva, and its droppings. This is the most important fact about the disease, and the one almost no media coverage explains. The mouse you should worry about looks identical to the mouse you should not. The infestation is invisible from above. You cannot tell, by looking at a shed full of droppings, whether the mice that left them carry the virus or do not. The exposure happens when those droppings dry out and get disturbed. When somebody walks into a cabin in spring and sweeps a winter's worth of mouse residue off the floorboards. When somebody opens an attic and starts moving old boxes. When somebody mows a field and aerosolizes old hay bedding. The dried excreta breaks apart into airborne particles, the virus comes with them, and a person breathes them in. The particles travel down the airway and reach the alveolar capillaries, the smallest blood vessels in the lungs. This is where the disease becomes dangerous. The virus itself does not destroy the cells lining those capillaries. The damage is done by the immune response trying to clear them. A massive T-cell attack on infected endothelium triggers an inflammatory cascade that opens up gaps between cells. Plasma leaks. Fluid leaves the bloodstream and pools in the air spaces of the lungs, and the patient begins to drown from the inside. The medical term is non-cardiogenic pulmonary edema. The bedside experience is a previously healthy adult who, 4 to 10 days after first feeling flu-like, cannot get enough air, cannot lie flat, and is gasping in a chair while a nurse tries to find a ventilator. There is no antiviral and no licensed vaccine in the United States. Treatment is supportive. Oxygen, mechanical ventilation, and in the worst cases, extracorporeal membrane oxygenation. A machine that breathes for the lungs by pulling the blood out, oxygenating it, and pumping it back in. Survival is largely a function of whether the patient reaches an intensive care unit in time. The incubation, that is, the gap between exposure and first symptoms, can be as short as 4 days and as long as 42. That is the same range the World Health Organization is using to set the quarantine for the cruise ship returnees in Omaha. It is also why the Ontario County patient is unusual. The classical pattern is a sharp febrile prodrome followed within a week or 10 days by acute respiratory crisis. The patient in upstate New York has been mildly ill for weeks without a crisis. There are 3 possible explanations for that, and this is where the textbook story starts to break down. The first possible explanation is that this is not really hantavirus, that the blood work is producing a false signal, and that the patient has something else entirely. This happens Cross-reactive antibody tests can pick up a recent exposure to a related virus and call it Hantavirus. The Centers for Disease Control will have a much more precise answer in days. The second possibility is that this is Hantavirus, but a strain that produces a milder illness, perhaps a sole virus exposure picked up from urban rats, which can produce a flu-like syndrome without the lung crash. And the third possibility, the most clinically interesting one, is that this is genuinely Hantavirus pulmonary syndrome in an unusually mild form, caught early enough that the lungs never deteriorated. Whichever it turns out to be, the patient is recovering, which is the part Kate Ott was most relieved about on television. That brings us to the difference between the patient in upstate New York and the patients on the cruise ship in Tenerife. The cruise ship outbreak involves a different strain entirely, not sin nombre, not the New York virus. The strain on the Hondius is called Andes virus, after the Argentinian mountain range, where it was first identified in the mid-1990s. Andes virus does something that no other hantavirus in the Americas is known to do. It spreads from person to person. This is the single fact that has driven 2 weeks of headlines. It is real. It was first documented in a place called El Bolson in southern Argentina in 1996, when a doctor caught the disease from a patient he had treated without having had any contact with the rodent reservoir. Subsequent outbreaks in Argentina and Chile in the early 2000s confirmed the pattern. Andes is the only known hantavirus that can pass between humans, but it is not very good at it. The number you may have seen quoted in the cruise coverage is an R0 of about 2, meaning that in a fully susceptible population, each infected person infects roughly 2 more. That number comes from a single well-studied outbreak in Patagonia. Dr. Thomas Russo at the University at Buffalo, who has been one of the more careful voices in the news cycle, has been quick to point out that there are other examples in which a person with Andes hantavirus exposed 50 people and infected none of them. The honest answer is that the field does not have a stable estimate. Spread requires close, prolonged contact, generally with someone who is visibly sick, which is why the cruise ship, in which hundreds of people lived together for over a month in a confined environment, is exactly the worst case setting for it, and why the quarantine system is exactly the right response. There is still no antiviral and no licensed vaccine for Andes either. A handful of candidate vaccines have been worked on at the United States Army Medical Research Institute of Infectious Diseases, including DNA-based candidates that have completed early human trials. None have progressed further because the market is small and the disease is rare. Treatment, for now, remains supportive. And here's the most important thing the cruise coverage has not said. The rodent that carries Andes virus, the long-tailed pygmy rice rat, lives in southern Argentina and Chile. It does not live in North America. Even if every American passenger from the Hondius were to walk off the plane carrying Andes virus, the virus would have no rodent reservoir to establish itself in on this continent, which is the biological reason this is an outbreak, not a pandemic. Which brings us to what most of the coverage has gotten wrong over the last fortnight. The first thing is the flattening. American News has spent 2 weeks using the word hantavirus without specifying which one. Sometimes it means Andes, sometimes it means sin nombre, sometimes it means the whole family. The result is that an audience has been primed to treat every hantavirus story as the same hantavirus story. So, when a patient in upstate New York tests suspected positive for what is almost certainly a domestic, rodent-borne strain that has been here since before the country had heard the word, the audience hears it as another cruise ship case in a different city. It is not. The strains are biologically distinct, behave differently in the body, spread by different routes, and have different rodent reservoirs on different continents. Calling them by the same name is technically accurate. Calling them the same thing is not. The second thing is the COVID echo. The cruise ship, the quarantine, the respiratory illness, the 42-day incubation, the chartered medical flights to a national quarantine unit, all of it triggers a pandemic-shaped reflex that does not fit the biology. The Director General of the World Health Organization, Dr. Tedros Adhanom Ghebreyesus, wrote an open letter last week to the people of Tenerife, where the Hondius is docked, in which the sentence, "This is not another COVID," appeared in plain text. He said it because he had to say it, because the public discourse by the 11th of May had already moved into pandemic vocabulary. Multiple infectious disease specialists have been doing the same work in interviews this week. Dr. Amesh Adalja at Johns Hopkins, Dr. Krutika Kupali at the University of Texas Southwestern, Gustavo Palacios, a hantavirus researcher at the Icahn School of Medicine at Mount Sinai, who is originally from Argentina, summarized the problem to Reuters in 5 words. We have kind of lost perspective. The third thing is the endemic story most of the coverage skipped over entirely. The cruise outbreak has produced 10 confirmed cases and 3 deaths since the beginning of April. Endemic American hantavirus, the kind in the deer mice and the white-footed mice and the rice rats and the cotton rats, has killed roughly a third of the 890 Americans severely ill enough to have been diagnosed with it since 1993. The most recent high-profile death was Betsy Arakawa, the wife of Gene Hackman, in February of last year at the couple's home in New Mexico. The American risk has always been, and remains, the unglamorous one. It does not arrive on a ship. It arrives in old sheds, attics, rural cabins, woodpiles, garages, and barn corners. It arrives when the weather warms up in May and somebody opens a cabin door that has been closed all winter. All of which leaves one actionable piece of advice, and it came from Kate Ott on local television this week. If you're about to clean out a space that may have mice in it, ventilate the space before you start. Damp mop the floor rather than sweeping it. Wet the droppings down with a household disinfectant before you touch them. Wear a real respirator, an N95 or better, not a cloth mask. And if there are weeks of rodent residue in there, get someone else to handle the worst of it. That sentence is more useful than the entire 2-week news cycle about a cruise ship that, at this point, the United States has already put behind glass. All of which leaves the question of what the New York case actually means for the rest of the country. Two things will be clear within the next month. The first is what the Centers for Disease Control says about the Ontario County sample. The most likely result is that it is some variant of an endemic American hantavirus, picked up by a patient through normal rural exposure that the patient may not even remember. If it is sin nombre, that would be unusual for the Northeast, but not unprecedented. If it is the New York virus, that would be the first confirmed case of New York virus in human medical literature in years, and a small data point that the surveillance system, even after 30 years, is still catching strains it had not seen present clinically. If it is sole virus from rats in an urban or peri-urban setting, that would fit the mild presentation and would be a worrying signal about old world hantaviruses establishing in American rodent populations. And if it is none of those, if it is a cross-reaction or a false signal, the case will quietly disappear from the news and Ontario County will move on. All of these are possible. None of them is a reason to be worried about the rest of the country. The second thing is what happens to the cruise ship Outbreak. The last new case was reported on the 2nd of May. The full incubation window is 42 days. If no new cases appear in the cruise cohort after roughly the middle of June, the outbreak is biologically over. The ship will be back in the Netherlands. The American passengers in Omaha and Atlanta will be back in their home states. The federal level 3 emergency activation, which is the lowest emergency level the Centers for Disease Control uses, will quietly be stood down. Genetic sequencing of the cruise isolates has already confirmed that the virus is the same Andes strain that has circulated in Argentina and Chile for decades, with no novel mutations. That, in plain English, means this is not a new disease and is not on its way to becoming one, which leaves the larger problem. American discourse, 6 years out from COVID, is still primed to treat every outbreak story as the start of the next pandemic. There is some good in that. The level of scrutiny that the cruise ship has received from the public health system is high, fast, and competent. The National Quarantine Unit in Omaha has been activated for its largest operation since Ebola in 2014. The Centers for Disease Control has held regular briefings. The World Health Organization's Director General has held regular briefings. Trial by Twitter has not, this time, completely overrun the official communications. But there is also a cost, and the Ontario County case is its small, illustrative example. While the system was looking outward at the ship in the Atlantic, the endemic American disease that has been killing people quietly for 30 years almost slipped past Kate Ott's office because the timing was, in her own words, horrible. She caught it anyway. The patient is recovering. The Centers for Disease Control sample is on its way. The system held. But there is a version of this story in the next county over, in the next state, in the next outbreak, where it does not. The risk to the average American from the cruise ship today is essentially zero. The risk to the average American from rodent-borne hantavirus today is small but real, concentrated in rural places, and entirely manageable with the standard precautions. If you remember one sentence from this video, make it Kate Ott's. The hantavirus that occurs in the United States is not spread person to person. It is spread between mice and humans. The first part is the relief. The second part is the work.